today. For those that were unable to attend today's event here in person at Hope Fellowship Church, today's event is basically about mental health awareness. So today at Hope, our event is titled Hope Health Men- Mental Health Summit. Today we do have a guest speaker by the name of Quan Denny. He will be our first speaker for today. Of course, this summit we want to focus on, of course, our health, our mental health, and physical health. We are here to support everyone, but our main focus is on men's this month. So with that being said, I'm going to go ahead and hand the mic over to Quan Denny.
All right, so my name is Quan Denny. I'm from the Rockford area. I built a business, Royal Living, and it's based around mental health, lifestyle, overall fitness. And what started me with building this business was some of the things I dealt with personally in my life, which revolved around mental health. So from a man's perspective, according to medical news today, 1 out of 10 males suffer from mental health. And so basically what I'm gonna speak about is ways we can counter that and possibly help men out and taking care of the mental health issues. So what is mental health? Mental health is situations that arise that can come from dealing with family issues, health issues, money issues that can bring issues such as anxiety, depression, different disorders in general. So over the years, I've been in the fitness industry for about 17 years, and one thing I have noticed in males is when they come to me, the common complaint is that they're either fatigued, they can't sleep, they have restless sleep, um, foggy thoughts, and I always ask them what's different in their life. And many times they say, well, I've been dealing with depression, anxiety, and so what I normally do is I have them go on 4-week cycles, basically with starting light with exercises, basically cardio, movements, and after the 4 weeks, I come back and determine basically what the causes of their mental problems were. So overall, mental health, common denominator in mental health is, for men, a lot of men, is depression. It's been said that people who exercise regularly have better mental health and emotional well-being and lower rates of mental illness. Now, we all know exercise is important for people with mental illness, but not only does it boost our mood, concentration, and alertness, but it improves cardiovascular and overall physical health. By doing just 30 minutes or more of cardio a day, 3 to 5 times a week, you can improve depression or anxiety symptoms. What happens when you're doing cardio and exercising, it releases endorphins. Endorphins releases endorphins. So basically, that triggers something in your brain to release the feel good, which helps you get through your day, gives you energy, similar to what natural sunlight does. Researchers have found that lack of sleep problems, a lack of energy, and physical inactivity may lead to a depressed mood and mood changes. Of course, physical activity can bring health benefits, but it also elevates mood and reduces stress. But also, the biggest thing I also notice in my clients is the food aspect. I'm a big person that believes what goes in your body will also come out of your body, whether it be through your pores or through your thought process. So one of the businesses I started was a men's health group, high level men's group, and that's based on overall physical being plus mental being. Um, in many instances, most men don't have outlets to reach out to in the community elites. And one of the biggest reliefs for men to have outlet has become the gym. So roughly 18% of men express themselves through physical activities. That's why the physical aspect of working out is important because it helps clears your thought process for the mental aspect. Um, so with my group, our focus is on being able to have men become more comfortable speaking about the issues overall in their lives, whether it be for the family, the money situations that can trigger different disorders. I was planning on having. So one quote I live by is Deion Sanders' quote. As I'm wearing my Colorado, Deion Sanders' quote is, "If you look good, you feel good." Now, may not also always necessarily be true because you can also always look good, but you may not be feeling good necessarily inside. So that's why it's important to focus on cardio, food, moving every day, getting sunlight, and putting the right foods in your body.
So again, if you're not able to come, we again appreciate you for streaming with us. We do have downtown discount drugs here. They do have vaccines, flu vaccines available. So if you are interested in receiving your flu vaccine, we will still be here until 4 o'clock today. So again, downtown discount drugs are here until 4 p.m. today. They do have flu vaccines. And just if you guys give me one moment, I will introduce my next speaker. Hope is Hope Mental Health Summit. Again, we will be here until 4 p.m. today. We do have downtown discount drugs here giving out flu vaccines. So, again, you are more than welcome to come down and take advantage of that. This is the season. So, we, of course, want to make sure that everyone is staying healthy and staying safe. And again, COVID is still out there. So, also, if you don't know where to get a COVID vaccine or if you want more information on COVID, we can definitely provide you with that information as well. So again, today's event is our health summit, and we want to encourage everyone to gather as much information as possible when it comes not only to your mental health, but also just your general health. Because of course, when you take care of your body, you're also taking care of your mind and also your soul. And as my pastor, Pastor Alexander, always say, if you are looking for a home church, I know a good church, and here at Hope Fellowship, our address is 1135 East State Street. Our Sunday services start at 10:30 a.m. every Sunday. Of course, we have in-person service, and then we are also streaming online as well. Again, thank you so much for your patience. I am Our next speaker is Jose Gloria. He is still setting up, but he will be coming up next speaking about Medicare. So that is always interested to find out more information. Also, in addition to Downtown Discount Drugs, we do partner up with Oak Street Health and also Molina Health. So if you are not aware of those organizations, you can definitely inbox us here at Hope, and we can provide you with that information as well. Um, so yeah, again, thank you guys very much for your patience, and our next speaker will be up shortly. All right. Again, thank you very much for your patience, and I will be handing the mic over to Jose Gloria. Thank you.
Where should I go? Just right here? Okay. All right. Well, like Shawana said, my name is Jose Gloria. I am an insurance agent. I've been helping people here in the Rockford, Boone County area, Chicagoland area, for about 10 years. I've been associated with Oak Street Health since they've opened here in Rockford as well too. So a lot of experience helping people with Medicare. I know it's not a very fun topic and it's kind of boring. I'm sure if we had more people here, I'm sure I would see some people nodding off. So I'll try to keep it as interesting as possible. So let's go ahead and get started. Again, this is Medicare 101. We're going over the basics, so we're not going to dive too deep into it, but I just want to give everybody a good understanding of what Medicare basics are. So we're going to talk about what is Medicare, who is eligible, the different parts of Medicare, what it costs, how to enroll, what your options for Medicare are, supplements versus Medicare Advantage plans, and then the Part D prescription drug plans as well. So real quick, President Johnson in 1965, he was one most people who are 65, age into 65 years old, will qualify for Medicare as long as they've worked at least for 10 years or 40 quarters and have paid into Social Security. Some people who meet certain disabilities may also be eligible for Medicare, and then people who have been on Social Security disability for at least 24 consecutive months will qualify for, generally will qualify for Medicare on the 25th month of their disability. Also, anyone with end-stage renal disease or ALS will qualify automatically. So people who qualify for original Medicare, there's a few different choices as far as coverage goes. You can stay on original Medicare, and you'll hear me reference that a lot. So original Medicare are Part A and Part B. We'll talk about that more a little bit later. You can go with original Medicare and a Medicare supplement, a Part D, and we'll learn the alphabet of Medicare here pretty soon. But Part D coverage, D is for drugs. It's just the easiest way for me to remember that. The Part D coverage is called Prescription Drug Plan, which is a PDP, but I think Part D is just a lot easier to remember. And then Part C, with or without a Part D coverage, or what's called a Medicare Advantage plan. So again, this is the alphabet of Medicare. Part A is what your hospital coverage is. Part B is what your medical coverage is. So Part A and Part B, that's what we refer to as original Medicare. Part C is a Medicare Advantage plan, and Part D, again, D for drugs, is a prescription drug coverage. So who qualifies for Part A? Again, anybody. Generally, Part A is premium free as long as you've worked at least the 40 quarters or 10 years and have paid into the FICA taxes. If your spouse has passed and you don't qualify for Medicare, you may qualify through your spouse. And to qualify for Medicare, you must be a U.S. citizen or a legal U.S. resident for at least the last 5 years continuously. So again, original Medicare, Part A and Part B. Part A is hospital insurance. Part B is Medicare coverage. There are gaps in coverage. Medicare is not free by any means. There are copays and deductibles, which we will talk about. Uh-oh. I thought we were having technical issues, but it was just me being silly. Okay, Medicare coverage. Part A, again, inpatient hospital care. So basically, if you go into the hospital, Medicare Part A, that's where you get that coverage. Some skilled nursing, and we'll talk about that as well, hospice, and also home health care. So let's talk about inpatient hospital stays under the Part A coverage. So the first 60 days that you're in the hospital, so if you go in from, well, when you go into the hospital, right away you're going to get a $1,600, you have a $1,600 deductible, which means that you pay the first $1,600. The good news is that's good for what's called a 60-day benefit period. So just as an example, let's say you go in January 1st. And then you don't go back until April 1st. So now, since it's past that 60-day benefit period, you are going to get another $1,600 bill. So if you're in the hospital past 61 through 90 days, then you're going to get a $400 per day copay. From 91 to 150, you get $800. It's an $800 per day lifetime reserve as copays. And then after that, days 151 and over, then you're going to foot the entire bill. So talking about skilled nursing, for the first 20 days, from day 1 to day 20, there's no copay, but from days 21 to 100, there's up to a $200 per day copay. Then after that, from day 100 and forward, then you're footing the entire bill. And again, this is Medicare Part A. This is original Medicare with nothing else. Okay? Skilled nursing facility. We're just going to go through this real quick. So Medicare will pay for skilled nursing if your doctor prescribes it. If you need it every day, not just like every other day, and you have already been admitted to the hospital and have stayed at least 3 consecutive days. So a little bit more about that. You receive skilled nursing care within 30 days. You receive nursing care within 30 days after you've been discharged from the hospital, so that would be covered under the skilled nursing. And then obviously the skilled nursing facility needs to be covered, needs to participate in the Medicare program. Your doctor needs to agree that, yeah, you do need to go to a skilled nursing home, and they provide the level of skilled nursing care that you need. There are actually different types of nursing care, okay? But we won't go into that too much. Skilled nursing care, again, Medicare only covers short-term skilled nursing care with no payments after the first 100 days. And this is just a couple of different types of nursing care. There's custodial, and then there's immediate care. So depending upon the type of care that you need, Medicare will not generally pay for custodial or immediate care. Home health care. So home health care, again, covered by Medicare if you need a part-time skilled nursing, physical therapy, or speech therapy. If you're confined to your home, if your doctor says that you need it, and if the agency that will provide the home health care coverage does participate with Medicare. Okay, so this is generally where I ask questions or try to wake people up. Okay, so Part B. So Part B pays for things like doctor services, outpatient hospital services, and also medical services and supplies. So labs, outpatient like colonoscopies, that kind of thing. Part B coverage, it's an 80-20 coverage. So what that means is that under Medicare approved expenses or procedures, Medicare will pay 80% and we're on the hook for 20%. Okay? Certain drugs administered by a physician are also covered. So what that means is that if you need, let's say, some kind of infusion, like a vitamin infusion or something like that, that's administered in the doctor's office, then Medicare will pay for something like that. Okay, generally. There is a $226 annual deductible for Medicare Part B, and that's this year, 2023. There is a cost. There's a monthly premium for Part B, and that's $164.90. Some people may qualify to get that waived depending upon their income. So if they're under a certain income level, they may get that waived through the Medicare Savings Program. Or if they qualify for Medicaid, depending upon the level of Medicaid, they could also get that waived. If you're a higher earner, if you were a higher earner throughout your career, then generally you're going to pay more than the $164 or the $165 a month. But most of us are going to pay for that the $164.90 a month. Generally, the premiums come straight out of your Social Security check. If you go on Medicare before you apply for Social Security, then you'll get a bill. Okay? You can either pay the bill quarterly or you can go monthly. Okay? So real quick, Medicare Part B coverage. Some of the things that it covers, we talked about services received in the hospital, doctor services, doctor's office, doctor's nurse, assistant surgeon fees, diagnostics, tests, procedures, administrative drugs, outpatient services, emergency room, clinic, physical therapy, administer drugs, labs, x-rays, radiology, and then other services, independent lab tests, your ambulance, and then a few other things that are also covered by Medicare Part B coverage. Things that are not covered by Medicare. So dental care. Medicare does not cover dental care unless it's an emergency. So you get in a car accident or something and you lose half your jaw. That's something like that probably would be covered. But to go into a dentist's office to get a routine cleaning, Medicare does not cover that. Oral surgery, routine foot care, so podiatry, eye or ear examinations, immunizations, or chiropractic services, except for manual manipulation of the spine. What does that mean? That's just a fancy word for somebody cracking your back. That's pretty much it. Outpatient services, cosmetic procedures, not medically necessary. So if I'm on Medicare and I wanted to get some Botox on my lips so I could have fish lips or duck lips or whatever they are nowadays, Medicare wouldn't pay that for me. Lab tests, not medically necessary. So if you go get an MRI, you don't like the results, you want to go get another MRI, they're probably not going to pay for that. Medical services supplies, again, dental plates, so your like partials, dentures, that kind of thing, orthopedic shoes, first aid supplies, self-administered drugs, even with a doctor's prescription. So insulin is a big one here. And then we'll talk about that. Eyeglasses and hearing aids. So paying your share under Part B, again, if you're a high earner, then depending upon your income, your Part B is going to be higher. So just let's go to the extreme here. So if you made $500,000 a year or more, then you're going to be paying $560 some odd a month for your Part B. If you made $500,000 a year, I don't think you're going to have a problem paying that. Some Medicare penalties to avoid. So Part B. Generally Part B, when you are eligible for Part B, you should apply for it unless you have what's called credible coverage. So credible coverage is generally what you have through, say, an employer, maybe even the service. But if, let's say, you don't have credible coverage, you qualify for Medicare, you decide to delay Part B, then Medicare is going to penalize you. So 10% a year for every year that you didn't qualify or you didn't apply for Medicare and then decided that you did. So just a real quick calculation, $164.90. You guys didn't know there was going to be math in today's exam, did you? So $164.90 times 10%, $16.49. So if this person didn't apply for Medicare when he could have for 2 years, then that's going to be an additional $32.98 that's going to come out of his Social Security. Okay? And that's something that the carriers don't, they don't penalize you, but they have to collect it on behalf of Medicare. So real quick, enrolling in Medicare, if you're already drawing Social Security, you'll automatically be enrolled in Medicare when you turn 65. If not, then you have to apply. The easiest way to apply is to go to ssa.gov and apply that way. It's really pretty easy to do. You can also call the Social Security office and they can help you as well. Not very hard to do. I can help you as well too. I've helped many people do that. If you're signing up for Part B, for the first time when you're first eligible, you may be able to avoid the penalties, like I said, if you've delayed Part B, but you've had employer coverage. There's a couple forms that you have to fill out, but not very hard to do. Again, I'd be happy to help you with that. When does it start? So generally Medicare starts on the first day of the month of your birthday. So if you turn 65 in September 30th, then your Medicare coverage would start on the first day of September. A few enrollment periods. So I'm sure you've probably heard a lot about the annual election period that's coming up. So that's from October 15th to December 7th. your initial Medicare enrollment period, that's when you first are eligible for Medicare, it starts 3 months prior to your birthday month. It includes your birthday month, and then 3 months after your birthday month. Does that make sense? So if we're in September right now, then we would have been first eligible August, July, June. So June 1st, we would have been eligible for Medicare. If we decided not to enroll yet, we decided to wait, then we can wait up until, so this is September, right? So October, November, December. So we can enroll in December. They give you a 7-month window. I would not recommend that. Obviously, I would encourage that you coordinate that with whatever coverage you have currently, especially if you're leaving an employer. That way there's not a gap in coverage for you. Medicare is also an individual coverage. It's not a family coverage. So if you're thinking that, okay, I work at so-and-so place, I have my whole family covered on there, I'm going to turn 65 in October, and then I'm going to get Medicare for everybody, and that does not work that way. So only you will get Medicare, and then your family, you're going to have to find alternative coverage for them. What is AEP? So AEP, like I mentioned earlier, is an annual election period from October 15th to December 7th. That's when you can switch to original Medicare if you're on a different type of Medicare plan, like a Medicare Advantage plan, or you can stay on your current plan, or you can switch within plans. And your new coverage will begin on January 1st. I'm sure you're going to see a lot of commercials about the annual election period. It used to be that you saw some commercials with J.J. Walker, Jimmy Walker, I don't know if you remember him, or Joe Namath. Those guys were representing some different insurance companies. Again, if you're still working when you turn 65, if your employer has more than 20 employees, then you can delay enrolling in the Part B. And as long as your employer has what's called the credible coverage. An SEP is in a special election period. That's if something, an approved event happens to you, then you may get another couple months to change or elect new coverage through the SEP. One of them is say that you move from one state or even one county to another. If you are in a Medicare Advantage plan, then it will open up a special enrollment period for you. Special election periods last 8 months, so that's when you can apply for Medicare up to 8 months after the beginning of your special enrollment period. I know this is kind of hard to see, but it's a few different options for Medicare coverage. So the first one is Part A and Part B, which is original Medicare, plus a Part D. Or you can go with a original Medicare, a Part D, and a Medicare supplement, which we'll talk about in a little bit. And then also Medicare Part C, which is a Medicare Advantage plan that includes coverage for Part A and Part B. Many of them include a Part D and also extra benefits, which we'll talk about, and maybe a hospital indemnity plan. So let's talk about a little bit about a Medicare supplement plan. This is different than original Medicare. This is exactly what it says. It's a supplement to original Medicare. So it helps cover the gaps. Remember that $1,600 copay that I was talking about when you have to go to the hospital? If you have a Medicare supplement, generally that's going to pay that for you. If you had to stay in more than the 61 days, then generally the Medicare supplement will cover that for you. What it doesn't have is a prescription drug plan. So that's something that you would have to look for. So Medicare supplement will only cover the gaps in Medicare, but not the prescription drugs. So real quick, Medicare supplement really doesn't have any network except for the fact that the provider has to accept Medicare. You can use it anywhere in the U.S. that the provider accepts Medicare. So it could be Chicago, New York, Florida, Seattle, Los Angeles, doesn't matter. As long as the doctor, the provider that you decide to go to accepts Medicare, then you're fine. the plans are standardized. So what that means is that any insurance company that offers a Medicare supplement has to offer the same benefits for that plan. So there are the two most common plans are the G and the N. We'll talk about that in just a little bit. Any carrier that offers a Plan G, whether it's Humana, United Healthcare, Aetna, if they offer a Plan G, they all have to offer the same basic benefits. So I'm sure a lot of us have heard the old phrase, you get what you pay for. Well, in Medicare, that's not necessarily the case because every plan under the same letter is the same. The only difference is how much you pay for that plan. You pay a monthly premium for the Medicare supplement. So remember, you also pay a monthly premium for your Part B. So you're paying a premium for the Part B and for your supplement. Shop around when you're looking for supplements because it could vary up to 186% is what they say here from one plan to another. And I have seen a huge difference from one plan to another for the same plan. It's recommended that if you're on Medicare, you shop for a plan every couple of months, or excuse me, every couple of years. Medicare supplement plan rate increase is generally between 2 to 6% a year. So every year that you have a birthday, generally when you're on a Medicare supplement, that premium is going to increase. Okay. I know this is really hard to read, but the Medicare supplements, again, the Plan G, which is this one, and the Plan N are the two most common plans, and we'll talk about that in a second. MACRA just says that if you were born, or excuse me, if you were eligible for Medicare after January 1st of 2020, you can no longer get a Plan F. So a Plan F was a plan, or C or F. One of these two plans, they included your $226 deductible, or actually the deductible at the time. So first dollar plans they're known as first dollar coverage plans. So what that means is that they did not require you to pay your annual Part B annual deductible first. Okay, the other plans do. Just real quick for the Plan G, you do have to pay the $226 deductible. So that deductible works kind of like your car deductible. So if you get in an accident, right, it's your fault. You have to pay your deductible first before your body shop will pick up the rest. It's pretty close to the same. So, for your Part B, Plan G, the Part B deductible, $226. If you go to the doctor, let's say January 5th, right after the new year starts, you get a $230 bill for labs, x-rays, whatever. You're going to pay $226 of that, and then anything after that, Medicare is going to pick up. Okay? Generally, Plan G offers more protection against unknown costs. What that means is that you always know what you're going to pay for your health care. So if you're paying, an example, $100 a month for your Plan G, then except for that $226 that you're going to pay first, your payment is always going to be $100 no matter what. Because if you have to go to the hospital, you get an MRI, or you have to stay for a couple months or a couple weeks, you're just going to be paying that $100. Okay. There is a high deductible plan option too. A high deductible plan anywhere from up to $2,700 for the year. That is an option for you. It will lower your premium, but then you have to consider is it worth my while to pay the $100 a month, which is going to be $1,200 a year, or be susceptible to the $2,700 a year. So that's something that you would have to consider. Plan N, pretty similar to Plan G. There are a couple differences. One, that you do have a copay for your provider and $50 for emergency room visits. It allows excess charges. What are excess charges? So Medicare, when it approves an amount for a procedure, that's called a Medicare approved amount. So let's say that I go to get a physical. My Medicare approved amount for a physical is $80. But let's say that I have a doctor that doesn't accept Medicare as a full payment. He can charge another 15% over the Medicare approved amount. So in this case, 80%, 80 times 15 is what? $4. So he can charge another, I think, $4 for that visit. It's very rare around here that any doctors do that. But that's something that you would be exposed to if you do have a Plan N. Okay, Medicare approved health plans. So besides the Medicare supplement, there's also the Part C. So it's an alternative to original Medicare. It's still as good as Medicare. This one, it's available on a county-by-county basis. Remember, we talked about Medicare supplement is good anywhere anywhere in the U.S. that a doctor accepts Medicare. It's a little bit different with the Medicare Advantage plans. They have networks. So we'll talk about that in a second. They are also offered by private insurance companies, so Humana, Aetna, WellCare, United Healthcare, etc. They have to have the same benefits as Part A and Part B as original Medicare. Many of them have no monthly or very low maximum monthly premiums. They do have maximum out of pocket. So what that means is that you have a certain amount that you would be responsible for. Medicare Advantage plans can include prescription drug coverage. If they do, then they're called an MAPD, which is Medicare Advantage prescription drugs. Or they can not have a prescription drug and be MA only. Generally, those are a good fit for veterans. So if you're a veteran and you have VA, then you may be interested in just an MA plan because you get your prescription drugs through the VA. Medicare Advantage plans have benefits that Medicare does not pay for. So remember, we were talking about the things that Medicare doesn't pay for. Medicare Advantage plans can have dental coverage, hearing, grocery card, over-the-counter benefits, vision benefits, a flexible spending card. This is one for you, fitness membership. So a lot of them, I'm sure you've probably heard of silver sneakers. So many plans participate in silver sneakers, or some of them are called silver and fit. So what they do is they give you an allowance for gym memberships. And then transportation benefits as well too. Part C eligibility, who qualifies for Medicare Advantage plan? So Medicare beneficiaries who are enrolled in Part A and Part B, and they must live in the service area. Again, the Medicare Advantage plans are county specific. So you must reside in the county that the plan is offered in. There is no medical underwriting, so as long as you qualify for Medicare, then you would qualify for a Medicare Advantage plan. Doesn't matter if you've had cancer, brain tumor, doesn't matter. And you must have a valid election period. So we just talked about the initial election period. We also talked about the annual election period. Another one is the open election period. That's from January 1st through March 31st. What that one is that as long as you already have a Medicare Advantage plan, then you can switch between those dates. And then we talked about a special enrollment period as well. So initial enrollment period, pretty much the same as Medicare. 3 months prior to your 65th birthday, the month of your 65th birthday, and then 3 months after. Medicare Advantage plans have networks. I had mentioned before, one of those is HMO. I'm sure you've heard of the health maintenance organizations before. With the HMO, you do have to have a primary care physician, and you also have to, most of them, have a referral to go see a specialist. And then you have to see providers who are within the network. If you go outside of the network in an HMO, then you will be responsible for the entire bill. PPO, Preferred Provider Organization, you have a broader choice of providers. You can also go outside of the network. It's going to cost you a little bit more, but you would be able to go outside of the network. You don't have to declare PCP, primary care physician, although it is encouraged. Okay. And then the VA, we were talking about that before. If you're a veteran, and you want some of the benefits that a Medicare Advantage plan can provide, then I would recommend a MA-only plan, where that way you keep your you keep your prescription drug coverage through the VA, but then you have additional benefits. If you have TRICARE, if you have retired, I think it's after 20 years in the service, then I would not go with a Medicare Advantage plan. I would stay with TRICARE. You can if you want to, but I would probably just stick with TRICARE. Then the prescription drug coverage, we had talked about that quite a bit. You can get them as a standalone PDP or embedded in a Medicare Advantage plan. You can't have both a Medicare Advantage plan with a PDP and then have another standalone PDP. You can have one or the other. Some of the things that you should look into before getting prescription drug coverage is a drug formulary. Formulary is just a list of medications that particular plan will cover, so you want to make sure that the medications that you take are covered under the plan that you're looking at. Okay, so this is where we'll talk about penalties again. So if you do not sign up for a Part D when you are first eligible, then you will be penalized 0.1% of what the average PDP is per month for every month that you could have had a Part D but didn't. So in this case, 1% an average PDP is $31.50. They're going to give us some math here in a second. This year standard Part D deductible, $505. Some carriers will enforce that, others will not. So here they give us a little bit of math on how to figure out the late enrollment penalty. So it's 1%, right, of that $31.50, which is 31 cents. So for 10 months, Mr. Smith did not apply for the PDP for 10 months. When he decided that he did want to, then now they're going to multiply the $31.50 times the 10%, which is $3.15. So his prescription drug coverage will be whatever the monthly premium is plus that $3.15 for as long as he's on Medicare, unless he qualifies for a low-income subsidy. Some more numbers about the Part D. We talked about the Part D deductible is $505. The initial coverage limit, so what that means is that there's several stages of drug coverage. The first one is initial coverage. That's when you pay your copays. When the value of the medications that you take plus the copays equal $4,600, then you go out of the initial coverage stage and you go into the coverage gap, otherwise known as a donut hole. I don't know if you've heard of the donut hole before. But once you're in the donut hole, now you're going to pay 25% of whatever the retail value of that drug is until all the values equal $7,400. Then after that, you go into the next stage, which is the catastrophic coverage. And then you pay 5% of the drug coverage, or $4.15 for generic, or $10.35 for all other drugs. Okay, I know that was a lot of numbers, a lot of information. I'm happy to answer any of your questions if anybody has any. I should have put my number on here, but you can contact Shawanda. I should be happy to give you my contact information. So thank you very much for letting me come.
Okay, thank you guys so much for tuning in. For those who are online with us streaming, so again, today's event here at Hope is a mental health summit. We will be here until 4 p.m. We do have downtown discount drugs here. They do have flu vaccines available. So again, this is the season. If you have not yet received your flu vaccine, we would like to make sure that you have access to that. So again, if you're able to come down today by 4 p.m., they will be here again giving out flu vaccines. If you're not able to come today, you can definitely inbox us and we can definitely provide you with their information so that you can definitely either walk in or schedule an appointment to get those flu vaccines. Tomorrow here at Hope, we are inviting you to attend our service at 11:30 a.m. here at Hope. We are still encouraging, again, our health summit, providing information not only about your mental health, physical health, and also your spiritual health. So again, thank you so much for tuning in. And again, if you are in need of any information regarding contact information for the speakers that are here today, please inbox us and we'll be more than happy to provide you with that. Thank you and have a great day. And again, we are still here until 4 p.m. with those flu vaccines.